Tamoxifen citrate is a medication used to treat breast cancer and also to lower the risk of developing breast cancer in high-risk patients. It works by blocking the growth of breast cancer cells and interfering with the effects of estrogen in the breast tissue. The daily dosage and the optimal timing for taking this medication should be determined by your doctor based on your specific condition and medical history. Before starting tamoxifen, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily for 5 years. If your daily dosage is greater than 20 mg, it is usually divided in half and taken twice a day, in the morning and evening. If you are using the liquid form, make sure to measure the dose carefully using a special measuring device/spoon. The dosage of tamoxifen is based on your medical condition and response to treatment. The duration of treatment to prevent cancer from returning may be between 5 to 10 years, depending on your medical condition and response to treatment. Make sure to take this medication regularly at the same time each day to get the most benefit from it. If you have breast cancer that has spread to other parts of the body, you may experience increased bone/cancer pain and/or disease flare-up as you start taking tamoxifen. In some cases, this may be a sign of a good response to the medication. Always tell your doctor right away about any new symptoms. Since this drug can be absorbed through the skin and lungs, women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the tablets. Make sure to inform your doctor right away if your condition worsens, such as if you get new breast lumps. Some common side effects of tamoxifen citrate include hot flashes, nausea, leg cramps, muscle aches, hair thinning, headache, and numb/tingling skin. Men may also experience a loss of sexual ability/interest. If these effects persist or worsen, it's important to inform your doctor. It's essential to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, if you experience any serious side effects, such as vision changes, easy bruising/bleeding, mental/mood changes, or signs of liver disease, it's crucial to contact your doctor immediately. Additionally, if you notice symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so it's important to communicate with your doctor or pharmacist about any other effects you may experience. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Tamoxifen citrate is a medication that is used to reduce the risk of breast cancer or to treat breast cancer that is limited to the milk ducts. It is important to discuss the benefits and risks of taking this medication with your doctor. It is important to seek medical help immediately if you experience symptoms of a stroke or blood clots in the lungs/legs, such as weakness on one side of the body, trouble speaking, sudden vision changes, confusion, shortness of breath, chest pain, or calf pain/swelling. If you develop symptoms of cancer of the uterus, such as unusual changes in your monthly period, unusual vaginal discharge, or pain/pressure below your belly button, it is important to tell your doctor right away. Before starting tamoxifen, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of blood clots, high cholesterol or triglycerides, limited mobility, diabetes, high blood pressure, smoking, cataracts, or liver disease. If you are planning to have surgery, especially breast reconstruction, it's important to inform your doctor or dentist about all the medications and products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. It's crucial to avoid becoming pregnant while using tamoxifen, as it may harm an unborn baby. Women using this medication should inquire about reliable non-hormonal forms of birth control during treatment and for 2 months after the last dose, while men using this medication should ask about reliable forms of birth control during treatment and for 6 months after the last dose. If pregnancy occurs, it's important to speak with your doctor immediately about the risks and benefits of continuing this medication. It is not recommended to breastfeed while using this drug and for 3 months after stopping treatment, as it is unknown if the medication passes into breast milk. It's essential to consult your doctor before breastfeeding while using tamoxifen. It's important to be aware of any potential interactions with other medications, as they may change how tamoxifen citrate works or increase the risk of serious side effects. Some products that may interact with this drug include anastrozole, blood thinners, such as warfarin, estrogens, letrozole, and hormonal forms of birth control. Additionally, other medications can affect the removal of tamoxifen from your body, which may impact how it works. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be aware that this medication may interfere with certain lab tests, so make sure that the lab personnel and all your doctors are aware that you are using this drug. As for the daily dosage and optimal timing, it is best to follow your doctor's instructions and take tamoxifen citrate as prescribed. If someone has taken too much tamoxifen citrate and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling emergency services or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include shaking, unsteady walking, fainting, or a fast/irregular heartbeat. It is important to take tamoxifen citrate exactly as prescribed by a doctor and to never exceed the recommended dosage. It's important not to share tamoxifen citrate with others. Your doctor may require you to undergo various lab and medical tests while taking this medication, such as complete blood count, liver function tests, pelvic exams, mammograms, and eye exams. It's crucial to attend all scheduled medical and lab appointments and consult your doctor for more information on these tests. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When storing tamoxifen citrate, make sure to keep it at room temperature and away from light and moisture. Do not store it in the bathroom. If you are using the liquid form, do not refrigerate or freeze it. Once you open the bottle, make sure to discard any unused liquid after 3 months. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of tamoxifen citrate, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.